Hi everyone, this is Prof. Kennedy Edem Kukia. Today I have something very short but exciting for you. I would like for us to look at dissecting pharmacology. We want to start from the very basics. Now, my idea about pharmacology is that it is interesting, it is simple to understand, but you need someone to guide you to really enjoy it. And so this is what I'm going to do to take you on a journey that will allow you to enjoy pharmacology and not endure it. So shall we start? So at the end of our short session, we would want to be able to explain what pharmacology is. We want to be able to discuss the divisions of pharmacology and then discuss the relevance of studying pharmacology. So when you pick pharmacology, you can split the word into two. And I think that this is always very important. You could always split the word into two. And hold on a bit. Let me pick my pen. So you split it into two. Here, you have two words. One comes from what we call pharmacon, and then the other one comes from ology, which basically is logia. Now, the pharmacon means drug or poison, and then the logia means the study of or knowledge of. And so anytime you pick pharmacology, know that it is a combination of two words, and one of the words, which is pharmacon, means drug or poison, and the other one, logia, means the study of or knowledge of. So when you put the two together or you marry the two, we can then explain what pharmacology is basically about. And so we will normally say that pharmacology is the study of the effects and interactions of drugs or poisons in living systems. But then the question is, if I am studying effects and interactions of these drugs or poisons, what about the effect do I want to study? What about the interactions do I want to study? So in looking at the effect, you may be looking at the beneficial effects the drug will produce, the deleterious or harmful effects the drug will produce. We also want to understand the journey on which this drug embarks, or the journey the drug embarks on in order to produce a particular effect in the body. And so this is basically what we are interested in when it comes to pharmacology. Now, on the basis of these effects and interactions that we study, we can divide pharmacology into two broad areas, two main broad areas. Now we have what we call the pharmacokinetics, which I would explain in a bit. We also have what we call the pharmacodynamics. So these two areas make up what we call the divisions of pharmacology. Of course, there are subdivisions in pharmacology, but the main divisions in pharmacology, anytime we are talking about a drug, we pick one drug and you want to talk about it, the main things you want to look at concerning those drugs would be their pharmacokinetics and then their pharmacodynamics. Now, when we talk about pharmacokinetics, what exactly do we mean? What exactly do we mean? And just as we did earlier, I would want us to again split pharmacokinetics into two. So we have, again, pharmacon as we did earlier, and then we have kinesis. Kinesis. Now, pharmacon, we've already said, means drug or poison, and kinesis means movement. Now, when you put that two together, what you see is the study of the movement of the drug. I always want to say that when you talk about pharmacokinetics, you are dealing with the journey the drug embarks on. So picture a drug that is swallowed. The journey the drug embarks on from the time you swallow it till the time it exits your body is basically what pharmacokinetics is about. Now, again, whilst the drug is on that journey, whilst it is moving from where you took it till it exits your body, there are things that that drug encounters. The body processes that drug in a particular way. And those things that the drug encounters, those processes that it undergoes when it goes through the body, again, is what we mean when we talk about pharmacokinetics. Now, this is why simply we tell people that when you talk about pharmacokinetics, we are dealing with what the body does to the drug. Because as the drug is embarking on the journey, there are things your body is doing to those drugs. And so whatever the body does to the drug is what you would refer to as pharmacokinetics. And in looking at the specifics, we'll normally talk about absorption, we'll normally talk about distribution, we'll normally talk about metabolism, and then we'll talk about excretion. So sometimes we say that we have the ADME factors, ADME, the ADME factors, ADME. So anytime we talk about the ADME factors, we are referring to the processes involved in the pharmacokinetics of a drug. Now, in subsequent videos, I'm going to take each of these processes, we would dissect them, would understand the processes or the factors that influence these processes. And it's going to be very interesting as we delve deeper into these areas. But for now, let's say that this gives us some understanding of what pharmacokinetics is all about. Then we move on to what pharmacodynamics is. And remember, we said that pharmacology, we have two divisions. One of the divisions is pharmacokinetics, and the other one is pharmacodynamics. And again, with pharmacodynamics, if you split it into two, we have pharmacon, which we said means drug or poison. And then we have the dynamicos. Dynamicos means power, activity, or effect. So simply, whenever you talk about pharmacodynamics, you are dealing with the power of the drug, you are looking at the activity of the drug or the effect of the drug. And in doing this, we could simply say that in pharmacodynamics, we are interested in the physiological and then the biochemical effects of the drug. And so I take a drug, blood pressure is reduced. That is the effect the drug has produced. And so when I study that effect, I am studying pharmacodynamics. Again, as scientists, we are not only interested in what drugs will do, we want to know how they do that. And basically, that is what we mean by mechanism of action, as we have in the second button. So anytime we talk about the effect of the drug, we are also interested in how that effect comes about. And basically, that is what mechanism of action is. And that is under pharmacodynamics. And so if I want to understand the pharmacodynamics of any drug, I should know the effect the drug will produce. I should also know how it produces that effect. But we are not interested in just these two. We also want to know what is the relationship between the amount of the drug we have given, which we basically call the dose, and then the response that is produced. And so let's say if I give 1 milligram of drug X and it produces 20% effect, probably if I gave 2 milligrams of the same drug X, I may end up producing 50% response or effect. And so that relationship between the dose that I give and then the level of effect I produce is also something that we consider when it comes to pharmacodynamics. Now, you would agree with me that I began by saying that in looking at the effect of drugs, earlier when we talked about pharmacology, we want to look at the beneficial effects and want to look at the harmful effects as well, or what we call the deleterious effects. And so in pharmacodynamics, that is where we address these things. We sometimes look at what a drug can do. We also want to look at whether it can produce any effect that we do not want or not. Some of the effects we know they would be produced, but that is not intended effects. We tend to call them side effects. Sometimes we can take advantage of these side effects to do other things for the patient or to treat other conditions for the patient. Then there are those that we consider as harmful. We don't want them. Usually we don't expect them. We call those ones adverse effects. And all of these are things that we normally study under pharmacodynamics. Now, we look at the relevance of studying pharmacology. Why do we have to study pharmacology? It's very simple. As we said, pharmacology deals with the study of drugs. If I know what these drugs can do, the benefits I can get from it, the dangers of the drug, it would help me as a health professional to know how to rationally or sensibly use the drug. And so if a drug is known to cure or to treat hepatitis, and that is all that drug does, I will not use that drug to treat diabetes once I know that all that the drug does is hepatitis and nothing about diabetes. And so there, because I have been able to know the use of that drug or the, let me say, the effect of that drug, I am using it in a sensible manner. The same way, I would be able to know what dose to give to my patient, how frequently I should use it, whether to hold on with giving a drug, whether to reduce the dose of the drug, and all that. And this comes from knowing or studying pharmacology. The next thing we can do when we study pharmacology is that it allows us to be able to individualize the therapy or to fashion therapy for a specific patient. Maybe my patient is supposed to take drug A, but this drug A is not very useful when the patient has maybe a particular condition. And so although drug A would have been used for the patient, because the patient is suffering from probably kidney failure, maybe I decide that I'm not going to use that drug anymore, or I'm going to use a particular drug instead. I may also decide that instead of maybe giving drug X at a particular dose, let me still give the drug X, but at a higher dose. Why am I giving it at a higher dose? Probably I've realized that if I give it at the normal dose that I know, it may not work because of something that is happening in that patient. So here I am individualizing the therapy. I am fashioning the treatment based on what I know about that patient. And all of these things come because we have studied pharmacology. Then the third thing is that when we study pharmacology, sometimes some people may not be health professionals. They may basically be scientists in the lab, and their understanding of pharmacology can allow them to come up with new treatments. So they discover what we call novel drugs, and they develop those novel drugs based on the understanding of the pharmacology of certain chemical molecules. And lastly, by understanding pharmacology, we could use drugs to help us diagnose certain disease conditions. So sometimes we use drugs to tell us whether a patient has this disease condition or that disease condition. And so these are some of the reasons why we will study pharmacology. I hope with this short video, you've had a very good understanding or the basic understanding of what pharmacology is all about. And until you receive the next video, stay safe, and I would hope to get you watching out for our next video. Please subscribe to our channel. The channel URL is, as you can see on the board. You can subscribe, like our page or channel, comment as you wish, and share the videos that we have uploaded, and turn on your notification so that anytime we upload any new video, you'll be able to receive an update or a notification on it. And until we come your way again, this has been Professor Kennedy Edem Ukia. Bye-bye.